When he was admitted to my hospital department, he was in extreme despair, confessing that he was close to suicide. For some reasons, he had suffered from a writer's cramp, which had recently become so severe that he was in danger of losing his job. Therefore, only immediate short term therapy could alleviate the situation. In starting treatment, Dr. Eva recommended to the patient that he do just the opposite of what he usually had done, namely, instead of trying to write as neatly and legibly as possible, to write with the worst possible scrawl. He was advised to say to himself, "Now I will show people what a good scribbler I am." And at the moment in which he deliberately tried to scribble, he was unable to do so. "I tried to scrawl, but simply could not do it," he said the next day. Within 48 hours, the patient was in this way free from his writer's cramp and remained free for the observation period. After he had been treated, he is a happy man again and fully able to work. It was the most severe case of stuttering he had come across in his many years of practice. Stutterer could remember. Had, had he been free from this speech trouble even for a moment, except once? This happened when he was 12 years old and had hooked a ride on a streetcar. When caught by the conductor, he thought that the only way to escape would be to elicit his sympathy, and so he tried to demonstrate that he was just a poor stuttering boy. At that moment, when he tried to stutter, he was unable to do it. Without meaning to it, he had practiced paradoxical intention, though not for therapeutic purposes. However, this presentation should not leave the impression that paradoxical intention is effective only in monosymptomatic cases. By means of this logotherapeutic technique, my staff at the Vienna hospital has succeeded in bringing relief even in obsessive compulsive neurosis of a more severe degree and duration. I refer, for instance, to a woman 65 years of age who had suffered for 60 years from a washing compulsion. Dr. Eva started logotherapeutic treatment by means of paradoxical intention, and 2 months later, the patient was able to lead a normal life. Before admission to the neurological department of the Vienna hospital, she had confessed, "Life was hell for me, handicapped by her compulsion and bacteriophobic obsession. She finally remained in bed all day, unable to do any housework." It would not be accurate to say that she is now completely free of symptoms, for an obsession may come to her mind. However, she is able to joke about it, as she says, in short, to apply paradoxical intention. Paradoxical intention can also be applied in cases of sleep disturbances. The fear of sleeplessness results in a hyperintention to fall asleep, which in turn incapacitates the patient to do so. To overcome this particular fear, I usually advise the patient not to try to sleep, but rather try to do just the opposite, that is, to stay awake as long as possible. In other words, the hyperintention to fall asleep arising from the anticipatory anxiety of not being able to do so must be replaced by the paradoxical intention not to fall asleep, which soon will be followed by sleep.